And now, a message from the Task Force on Reopening in a West Hall takeover.
Good afternoon. Coming to you from President Casey's room in West Hall, and on behalf of the Task Force on Reopening the Colgate campus, Professor Holm and I want to provide an update since our last communication to you at the start of the semester. So much has happened since we wrote to you in August. We couldn't be more pleased that we just completed our third week of in-person classes and our fifth week here on campus. What an accomplishment. One that we were cautiously optimistic would happen when we developed the plan, and one that feels even sweeter now that it has arrived. Congratulations, Colgate. We've worked together in order to stay together. Thank you. We have 56 days until Thanksgiving, when we will conclude the semester with 2 weeks of remote instruction and then final examinations. We thought that this would be a good time to share with you what's on the minds of task force members, explain why we didn't recommend proceeding to Gate 2 this past Tuesday, and also to share some biology as it relates to 4 important reminders: masks, distancing, travel, and guests.
The task force is remaining vigilant about our reopening plan by paying attention to the national and global context within which we operate. Yesterday, Governor Cuomo added an additional 5 states to the New York travel advisory list as a result of concerns about the rising number of positive cases in these states, the closest of which is Rhode Island. We are unfortunately also seeing a resurgence of cases in Europe and the rest of the world. Thankfully, even with this concerning news outside of Hamilton, New York, the number of positive cases at Colgate remains very low. As a result of this week's surveillance and targeted testing of faculty, staff, and students, only 2 new positive cases emerged. The task force was reassured by these results, which you can view on the dashboard at the Colgate Together website. We know that it is through the good work of so many that we have been able to keep these numbers low as we've been together for these last 5 weeks. We also know that we can't relax the good public health practices that have gotten us to this point and will continue to keep us here. But the fact that we do not have evidence for widespread chains of transmission does give us confidence going forward.
As Professor Holmes said, a lot has gone well that has allowed us to arrive at this point in the semester. We have identified and isolated early positive cases through our weekly surveillance testing. Compliance with the commitment to community health hasn't been perfect, but we remain hopeful because we see most everyone trying so hard to follow the guidelines. Again, we thank you for this. Finally, the in-person classes and engagement between our faculty and staff colleagues and students, as well as the connection between students themselves, even in these constrained times, have been worth all of our efforts. These were our primary goals for reopening, and it is rewarding to see them happening as a result of our being on the Colgate campus this semester.
So, if everything has been going well, in terms of the small number of positive cases, why have we been so concerned? Why didn't the task force and health analytics team recommend proceeding to Gate 2 this week? Because we know how quickly SARS coronavirus can spread among close contacts that are within 6 feet of each other for longer than 10 minutes and between those not wearing face coverings. You see, it's behavior that precedes the spread of the virus. And once the virus spreads, it will be difficult to contain, especially with just 95 rooms for isolation and close contact quarantine. An outbreak of positive cases could happen quickly and would result in exceeding the number of positive cases allowed by the state of New York, requiring us to go to remote instruction. That is why, after a week of concerning incidents of non-compliance, unauthorized travel outside of Hamilton, and most especially, the large number of close contacts identified, which occupy nearly 50% of our isolation and quarantine space, we recommended pausing in Gate 1 before opening up cross-residence hall visitation or the fitness center, 2 decisions that could have created additional opportunities for transmission, required additional space at the Wendt, or led to our needing to return to remote instruction by the state of New York. To be clear, the decision was made with the public health of everyone on campus in mind and should not have been seen as a punishment. We reopened together. We want to make sure that we can stay together.
Like you, we want to move to Gate 2. We worked tirelessly this summer to forge connections between faculty, staff, and students, and connections among students. With that in mind, we want to simplify our message to you. Across all gates and throughout this semester, think of these 4 things: masks, distancing, travel, and guest. Always wear your mask. Remain 6 feet apart from everyone but your roommate. Do not travel outside of Hamilton, and do not host guests. That's it. Masks, distancing, travel, and guest. We have been focused on that number of students who can gather, but I think we haven't been as clear as we should that it's not necessarily the number that matters. It's that the group remains 6 feet apart with masks on to prevent close contact. Travel and hosting guests also undermines all of the testing and isolation of positive cases that we have worked hard to achieve. We know you can do this. From the 2 new positive cases identified in this week's surveillance testing, a combined total of only 7 close contacts were identified, in contrast to the almost 40 identified last week. This is much more in line with what we envisioned for Gate 1, and it helps to reduce the strain on our close contact quarantine capacity. Next Monday, the task force and health analytics team will meet with President Casey and make a recommendation about whether to proceed to Gate 2. This would permit the fitness center to open and for students to visit other residence halls in a limited capacity. In-room visitation should still be avoided at Gates 2 and 3, however, because it is difficult to stay 6 feet apart within a residence hall bedroom and would almost certainly result in being identified as a close contact if someone you visited later tested positive for COVID-19.
As Dean McLaughlin said, we know you can do this. We acknowledge how tremendously difficult this has been and continues to be for you, but we are so proud of all your hard work in upholding the commitment to community health. We see you and appreciate you wearing your masks, and we can totally relate to the struggle to maintain physical distance from people you are socializing with. We also appreciate all the people we see walking, biking, and scootering around campus, and taking the cruiser rather than driving cars. But most of all, we are grateful for the opportunity to interact with you in and out of the classroom, which is why we are all here in the first place. We want to be able to connect, just not make close contact. From the West Hall bedroom where President Casey has addressed you for 5 weeks, thank you, stay safe this weekend, and go Gate.